The ABR recently announced that we are reintroducing the oral exam for diagnostic radiology certification. For over 1,000 of you who recently completed your internship, we share your excitement as you enter into radiology residency. And this new exam paradigm will be used by the ABR to allow you to demonstrate your knowledge and skills that you will acquire over the next 4 years. The reason for the change to the new exam is based on the idea that we would like to test what it means to be a diagnostic radiologist. And that's more than merely having medical knowledge and book skills that you would acquire over the time of your training. The key question has been, why is the ABR making this change to an oral exam? And that's a reasonable question, and starts with the fact that no testing instrument is perfect. And we acknowledge that. The instrument we've been using for about a decade now was focused very much on subspecialty knowledge and less on general knowledge. And we heard from many of our stakeholder groups that that was perhaps an area for improvement of the exam. More important than that, the idea that a radiologist can address nuance, communicate well, and be able to make judgment calls around the imaging studies that they are presented with is critical in what it means to be a diagnostic radiologist. And we hope that this new instrument, a return to something similar to the oral exam we administered for decades leading up to 2012, will better serve that purpose and allow candidates to demonstrate what they have learned over the length of the 4-year residency. The exam we're planning for 2028 will be delivered remotely, so you'll be able to do it from your office or home via video conference software and a testing platform that we've refined over the last few years with our other disciplines in radiology, including interventional radiology, radiation oncology, and medical physics. These disciplines continued with the oral exam through the recent decade. And in returning to that platform for diagnostic radiology, we're borrowing from what we learned from those processes, specifically with respect to the IT platform, the way in which we can deliver it and make sure that the candidates are comfortable with the process and that they know what is expected of them, and that it measures some of the skills that are beyond those that we can adequately measure with a multiple choice test. We learned from stakeholder groups over the last year that these were critical in producing an environment that has high quality diagnostic radiology skills as part of its emphasis. And we surveyed many groups, including program directors and program director faculty members who are part of this process to improve on exams, which is what we seek to do at the ABR. Rather than be complacent with a testing instrument, which we acknowledge is never perfect, we would prefer to go to the next step and say, how can we make it better? And we believe that this exam will, in fact, be a better test of the knowledge and skills that you acquire over the course of your training. The new diagnostic radiology oral exam will affect the class of 2027 and will be administered for the first time in early 2028. You may see that during the course of your residency, much of the training you receive will be guided toward these principles of attempting to measure your skills at observation, synthesis, and management in radiologic findings. These skills are critical beyond merely book knowledge in order for you to perform well as a diagnostic radiologist and meet the expectations of your medical colleagues and your patients. One of the questions the ABR has received is, why wait until 2028 to introduce these improvements to the exam process? And we believe that it was important not to alter the training expectations and testing expectations of individuals who currently are in residency. So with that in mind, acknowledging that we need at least a few years to refine these processes to make it so that the candidate experience is optimized, that the instrument itself is effective at concluding the assessment that we are trying to perform. We also acknowledge that there's a sense of apprehension when anytime a change is introduced, and we would like to give people enough time to adjust to that idea. This involves both the training programs. Do trainees need to be instructed differently or educated differently Certainly it involves the candidates themselves for certification. Perhaps they will study differently. And with these considerations in mind, we wanted to give ample lead time, even beyond what we need to create the process. We really wanted to make sure that people were comfortable with the idea, and that's why it's being introduced about 5 years after the announcement, rather than in a year or 2 or 3, which is arguably what it would take for us to develop a process in any event. Many of you may have questions regarding the ABR's transition to the new oral exam that will begin in 2028. We hosted an open town hall in May of 2023, and we provide that link for you if you would like to watch it. And if there are further questions, we also offer an email address that you can contact us if you want further information. We also have a large number of frequently asked questions on the website, and we'll be adding to that and refining it over the coming months and years as new questions develop and new information is available both to the candidates for certification who will be taking the exam, as well as the volunteers who will be participating in that process, either as content developers or as examiners when the exam is implemented in the next few years.